What is Respiratory Syncytial Virus, RSV? Symptoms and treatment. Hello and welcome to this important video aimed at educating parents about a common yet potentially serious health concern, Respiratory Syncytial Virus, or RSV. Whether you're a first-time parent or caring for multiple children, understanding RSV, its symptoms, available treatments, and prevention measures can help keep your child safe and healthy. Today, we'll cover everything you need to know about RSV, so let's get started. Respiratory Syncytial Virus, commonly known as RSV, is one of the most frequent respiratory viruses, particularly in infants and young children. It primarily causes infections in the lungs and respiratory passages. RSV circulates during the colder months, much like the common cold or flu, and spreads widely among children due to close contact at daycare centers, schools, or home environments. RSV spreads through respiratory droplets, much like a cold. When someone with RSV coughs or sneezes, the virus can contaminate surfaces, hands, or even be inhaled by someone nearby. A simple touch of a contaminated object like toys or table surfaces, followed by touching the nose or mouth, can lead to infection. While most people recover from RSV within a week or two, it can lead to severe complications in vulnerable groups. These vulnerable groups include infants, particularly those under 12 months, children with pre-existing health conditions like asthma or heart disease, and older adults with weaker immune systems. That's why it's critical to recognize the virus early and understand how to manage it effectively. One of the biggest challenges with RSV is that its symptoms often resemble the common cold, including a runny nose, mild coughing or sneezing, fever that may not be very high, decrease in appetite. For many children, these symptoms are manageable at home. However, RSV becomes particularly dangerous when it progresses to severe respiratory conditions like bronchiolitis, an inflammation of the small airways in the lungs, or pneumonia. In such cases, parents may notice symptoms like wheezing or a whistling sound during breathing, rapid or difficult breathing, where the chest appears to pull in with each breath, bluish lips or fingertips caused by low oxygen levels in the body, extreme tiredness or difficulty staying alert. These signs indicate that the infection has escalated and requires immediate medical attention. As parents, keeping a close eye on your child's symptoms and identifying when they worsen can make all the difference. Now that we've covered the symptoms, let's talk about treatments for RSV. It's important to note that there is no specific cure for RSV. Like many viruses, the infection has to run its course. Most cases are mild and can be treated at home with supportive care. Here are several steps you can take at home to help your child feel better. Hydration. Make sure your child drinks plenty of fluids. Keeping the body hydrated is crucial, particularly if fever or labored breathing results in dehydration. Nasal saline drops. Administering saline drops in your child's nose can help clear mucus and make breathing easier. You can also use a bulb syringe to gently suction out mucus if your child is too young to blow their nose. Comfortable environment. Stay consistent with a humidifier to keep indoor air moist, which can soothe irritated respiratory passages. Keep the temperature comfortable and your child well rested. Manage fever. Over-the-counter medications such as acetaminophen or ibuprofen can help reduce fever. Always follow the recommended dosage and consult your doctor if you have questions. However, some cases of RSV become more serious and require medical intervention. If your child is showing signs of severe infection, such as wheezing, bluish lips, or labored breathing, consult a medical professional immediately. In severe cases, hospitalization may be necessary, where treatments can include oxygen therapy, providing supplemental oxygen to assist breathing. IV fluids, to address dehydration when a child cannot drink enough fluids orally. Mechanical ventilation. In rare cases, a ventilator might be necessary to help a child breathe. These interventions are highly effective for managing critical RSV cases. The good news is that with proper care, most children recover fully, even if hospitalized. While it's impossible to shield children from every infectious disease, there are several steps parents can take to reduce the likelihood of RSV exposure. Prevention plays a key role in managing RSV risks. Practice good hygiene. Regular hand washing with soap and water is essential for everyone in the household. Teach your children to avoid touching their face, particularly their nose and mouth, after coming into contact with shared surfaces or toys. Disinfect common areas. Frequently touched surfaces like doorknobs, light switches, and toys should be cleaned regularly, especially if someone in the house is already sick. Limit exposure. Avoid bringing young infants, especially those under 6 months, into crowded environments during RSV season. Encourage sick family members to stay distanced from babies while they recover. Cough and sneeze etiquette. Teach children to cough or sneeze into their elbow or a tissue to reduce the spread of respiratory droplets. In addition to these practices, advances in medicine now offer tools to specifically prevent RSV in high-risk individuals. For example, vaccines for pregnant women are now available in many areas. By getting vaccinated during pregnancy, mothers can pass antibodies to their unborn child, providing early protection after birth. Additionally, high-risk infants may benefit from monoclonal antibody treatments. This new preventive medication helps to shield against severe RSV infection in babies with weakened immunity or underlying health conditions. By combining these protective measures with good hygiene, we can significantly lower the chances of RSV impacting our families. The best defense against RSV is staying informed and acting proactively. As a parent, you are your child's most important advocate when it comes to their health. Here are some easy-to-follow tips. Monitor symptoms closely. RSV develops and progresses differently in every child. Keep an eye on symptoms and know when they require professional help. Consult healthcare providers. If you have any doubts about your child's condition, don't hesitate to seek medical advice. Early intervention can prevent complications. Follow preventive practices. Good hygiene and limiting exposure to high-risk situations go a long way in protecting your child. Knowledge is power. Understanding RSV can help you feel more confident in providing the care your child needs, while also lessening unnecessary anxiety. Caring for a child during an RSV infection can feel overwhelming, but staying calm and taking it one step at a time will make the experience more manageable. Here's some advice to help parents and caregivers. Offer comfort. Your child may feel irritable or tired from their symptoms. Being there to comfort them can ease their stress while also improving their recovery. Focus on rest. Adequate rest helps the body heal. Make sure your child gets plenty of downtime to let their immune system fight the virus. Stay hydrated and nourished. Even small amounts of fluids like water, breast milk, or formula can help. For older children, try nutrient-rich soups or smoothies if their appetite is low. Consistency and patience go a long way. Remember, most cases of RSV are manageable at home and will resolve in a week or two with supportive care. As we wrap up this important discussion on respiratory syncytial virus, let's quickly recap the key points. RSV is a common respiratory infection that can affect anyone, but it poses greater risks to babies, young children, and older adults. Symptoms range from mild cold-like signs to severe breathing issues, which may require hospitalization. While there is no specific cure for RSV, supportive and medical care can manage symptoms and complications effectively. Prevention is your strongest tool. Simple hygiene practices, coupled with new vaccines and antibody treatments, help reduce RSV exposure and risk. Thank you for watching this video and taking the time to learn more about RSV. Parents play a crucial role in detecting and mitigating this virus's impact. By staying alert, informed, and prepared, you are protecting your child from potential health risks. Please share this video with other parents or caregivers to help spread awareness. For additional trusted resources on RSV or other health topics, check the description below. Remember, with vigilance and informed care, we can keep our children safe and healthy. Take care, and we'll see you in the next video.